Hello, my name is Sophia Kuhar,
I'm Nicholas Nader.
I'm Allyson Brown.
and we did a case study over the disease process of chronic lymphocytic leukemia, also known as CLL, and its effects on clinical results, diagnosis, and treatment. This is a project done by the medical laboratory science majors of the College of Allied Health Sciences of UC.
Our patient was a 51-year-old female who has a family history of breast cancer, diabetes, hypertension, and prostate cancer. The patient has shown a slowly increasing lymphocytosis that has been occurring since May 2016. This lymphocytosis has been a cause of concern, which led to the patient getting a flow cytometry test. From those results, CLL was diagnosed. CLL stands for chronic lymphocytic leukemia, which is mainly characterized by the gradual progression of an increased amount of lymphocytes appearing in a patient's peripheral blood. This disease is mainly seen in patients that are older adults and also tends to appear in males and females with the same frequency. Usually a patient will be tested for this disease after showing symptoms of chronic fatigue, weakness throughout the body, and swollen lymph nodes. Once the patient's blood is tested and looked at under the microscope, one of the main hallmarks if the patient had CLL are smudge cells. These cells are fragile lymphocytes that have ruptured and appear to be smudged.
The purpose of this case study is as an educational example on the evaluation of abnormal clinical results, as well as a way to discuss the process of diagnosis, prognosis, and treatment of CLL. This may also serve as an example of how different facilities approach a case such as this.
Patient was selected based on the ability to give us the most information and the most recent information. A CBC, diff, microscopic imaging, and flow cytometry was done to give us the data. With this information, we made an outline of the project and picked a final topic. Once this was done, scholarly sources were gathered and the poster presentation here was created. The equipment used for this case includes the DXI for CBC and differential, SMS slide and stainer maker to produce slides for view, and a light microscope for the observation of the slide, as you can see in the picture in the methods section, and a flow cytometry machine to observe cell markers. This machine showed expression of CD5 and CD23 monoclonal B cells, which is indicative of CLL. CD45 side scatter shows 26.8% granulocytes, 4.9% monocytes, and 61.2% lymphocytes. 43.2% of these lymphocytes are CD19 positive B cells. Negative expression of CD103, FMC7, CD38, JAK2, V617F, Flex, and BCR, ABL, P190, and P210 were all negative. As you can see in the results section, there are two tables. The one on the left is from the first time point in this study, and the one on the right is from the last time point in this study. The results of interest are the WBC count and the absolute lymphocyte count. In the first time point, the WBC was slightly elevated, but this could be indicative of anything up to like a minor infection to something more. But the absolute lymphocytes were increased with a normal range of 850 to 3,900 and the patient having 5,753. In the last time point, the WBC is still slightly elevated, but the absolute lymphocyte has jumped to 11,856. Smudge cells were found in the first slide that was created, which is indicative of CLL. And because of this, an albumin slide had to be created so we could properly do a manual differential. Once it was correctly done, elevated lymphocytes were found, and it led to a pathology review.
After all the patient's test results had been received, they were able to be diagnosed. The patient was officially diagnosed with CLL due to a multitude of reasons that were seen in their tests, the most obvious being their increased amount of lymphocytes that were seen in their CBC with DIF. The next would be the numerous amounts of smudge cells that were seen in their peripheral blood smear. Lastly was the patient's flow cytometry test results. Flow cytometry currently is the gold standard for diagnosing CLL in patients because it provides specific details into the lineage of mutated cells. By being able to immunophenotype the cells, it can be identified what the genetic mutations in the patient are, which will aid in diagnosing and designing a treatment plan. This patient's flow cytometry showed double positivity for CD5 and CD23, which is one of the markers of CLL with the highest sensitivity and highest specificity. The patient also had an IgVH mutation present, along with being negative for CD38, indicates that they have a good prognosis.
The limitation of this case study is that unfortunately we don't have a follow-up on this patient, and we don't know if any therapy was eventually started. However, we do know that as of January 22nd, 2022, there was no treatment plan created, as she was relatively asymptomatic, and drug studies show that drug therapy does not have any benefit for early treatment of CLL, and that it could actually have negative results as it is very harsh on the body and can wipe out the immune system when the illness has not started causing symptoms. Chemotherapy such as fludarabine, clotrimazine, pentostatin, cyclophosphamide, and rituximab are commonly used to treat CLL. Many of these are nucleoside analogs, which cause a termination in the DNA chains of malignant cells, causing them to not be able to grow and reproduce. You could also base chemotherapy on genetics, such as our patient with an IgVH hypermutation. A combination treatment of fludarabine, cyclophosphamide, and rituximab have shown increased progression-free survival compared to those without the mutation, such as those with a TP53 gene deletion. So because of this IgVH gene mutation, this patient is a good candidate for this form of treatment. However, if this treatment plan was not instated, monoclonal antibodies might be another option, as they're becoming more common as a first line or follow-up to chemotherapy. This is where you sensitize antibodies against specific CD markers, such as CD20, which would allow them to eliminate lymphocytes, bringing down her lymphocytic count, as well as decreasing malignant cells in her blood. That is our project, and thank you so much for listening.